So hi, today I'm going to explain about the description of each description of my chosen mechanism or product. So the product or mechanisms that I chose was the stethoscope because it was aligned with my um course, which is nursing. So the stethoscope is a vital instrument in healthcare. Uh, which enable us to listen to internal body sounds, especially with our patients. So the first thing that you're gonna do and having your stethoscope is that you're gonna have to prepare, of course. You have to clean the stethoscope. So cleaning the stethoscope is really crucial to prevent cross contamination between the patients. So obviously you have to use alcohol wipes to disinfect it. Second is to choose the appropriate earpieces, because properly fitting earpieces enhance sound quality. So they should fit snugly in your ears to minimize ambient noise and ensure clear transmission of body sounds. Third one is you have to position the the circle one in the diaphragm, no, in the diaphragm, which is designed for high frequency sounds. So it is to ensure its position correctly. So it should be flat against the skin for optimal sound capture. So typically used for heart and lung assessment. The second one is the fifth one is you have to place it in the diaphragm on the patient's chest, slightly left or right on the sternum. I mean, on the left sternum. So you have to listen for the characteristic, like the first heart sound, which is the lub dub. Then, the sixth one is you have to listen to the lung sounds. The moment when you plug the earpieces, so you have to move it to the diaphragm to various locations of the chest and the back. So you have to listen for it for the normal breath sounds and any abnormalities. Um, the seventh one, bowel sounds. So, but you have to position the diaphragm on the abdomen. So you have to listen in all four quadrants. So normal bowel sounds are gurgling noises indicating active digestion. So the next one is you have to analyze. So after oscillation, you have to reflect on the sounds that you've heard. You have to consider their characteristic, their rhythm, and intensity. Then you have to, lastly, you have to, I mean not last, you have to compare it to the normal findings. You have to use your knowledge of normal heart, lung, and bowel sounds as a reference. This comparison will help us in identifying any abnormalities. So lastly, you have to document your findings. So accurate documentation is essential. You have to record your observation in the patient's chart, specifying the sound heard and any abnormalities noted. So this documentation aids in ongoing patient care. So that's all.